TAVI, transaortic valve implantation, is done for patients who are suffering with severe aortic stenosis with or without some aortic regurgitation. Only precaution we need to take is the patient has some criteria to be seen whether they are suitable for TAVI or not. That is predominantly decided after echo by doing a CT angiogram. So, if a patient has an anatomy which is suitable for TAVI, we do TAVI in patients whose age is more than 65 years generally. So, any patient of more than 65 years with severe aortic stenosis with or without LV dysfunction, nowadays we take them up for TAVI. Other important thing we need to see whether when analyzing the patients for TAVI is how is the femoral artery from where the valve will be taken. So, if there is no particular disease, then probably the femoral artery procedure is in fact surgically better than surgical AVR. So, if a patient has femorals normal and has a severe aortic stenosis in age of more than 65 years and suitable for TAVI, we do TAVI.